Hello class. Today we're going to be talking about some terminology that we can use in anatomy class to better describe body structures and help convey a message to other researchers or other classmates. So in order to study anatomy, we have to describe body structures in a way that makes sense and can be followed by medical professionals and researchers worldwide. Think about this. How would you describe where your hand is relative to your elbow? Are you confident that other people will clearly understand what you're talking about after that description? And so, in order to allow for that understanding across disciplines and different researchers, certain terms are used to maintain consistency in how we refer to different body parts. And we're going to learn how to put those terms into action in this video. The first thing to understand is anatomical position, which is portrayed on this slide. Okay? Whenever we discuss a body part, we must talk about it relative to this position. So think back to the example of where your hand is relative to your elbow. Okay? Does that change when you're sitting in a chair versus when you're standing with your arms crossed? Right? Sitting in a chair, your hand may be below your elbow. With your arms crossed, your hand may be above your elbow. How do you describe that to somebody else? Okay? Of course, that position, that relative position, is going to change. Okay? So we use this standard position to describe what is going on with the body. Okay, so here are some of the features of the anatomical position. Okay? Standing upright with your feet flat on the ground, head facing forward with a level gaze, meaning your eyes are looking level or your face is level. Upper limbs at the side with your palms forward, okay, palms in front of your body, and feet parallel with toes pointing forward. Why that anatomical position is important is so we can have some consistency when we discuss anatomical terms. And here's another example of how things can get mixed up. Right? Standing upright, this gymnast's head is above her heart, but then in a handstand, things get reversed. The second thing we need to understand is how to describe these body parts using the proper relative terms. So you might want to say that your hand is farther away from your body than your elbow, but a description like that can be a mouthful if you describe every body part in that way. So scientists have come up with specific terms to describe one structure relative to another. So our first term that we're going to look at is anterior, which is toward the front surface of the body. Then we have posterior, towards the back surface of the body. Superior is the topmost point of the body. Inferior is towards the bottommost point of the body. Medial is towards the mid-sagittal plane of the body, or the midsection of the body. Lateral is towards the sides of the body. Proximal is towards the trunk or point of attachment. And distal is away from the trunk or point of attachment. So a good way for us to describe where our hand is relative to our elbow in anatomical position would be that our hand is distal relative to our elbow. Our hand can also be, if we look back, inferior relative to our elbow because it's towards the bottommost point of our body relative to the other structure. Okay, hopefully that helps you better put together a picture of how we would describe anatomical terms, and now we're going to put that into practice in a class assignment.